here is my presentation of a radiologic case study. Okay, so who are we talking about and what happened? This patient was a 16-year-old high school student participating in a Buff Puff tournament on campus. Anyone who's unfamiliar with this event, it's a volleyball tournament where teams made up of male athletes compete. Girls on the high school volleyball team are coaches for these respective teams. This patient had completed an epic rally and in celebration turned and proceeded to jump and hang from one of the basketball hoops that was lowered in the school gymnasium. Patient lost his grip and down he went with a big fall, having his right arm extended to cushion his blow. Here is a radiograph of the right elbow shown in a lateral view. We can see the ulna is articulating with the humerus. There are no frayed edges where the bones articulate, supporting no degenerative changes are occurring yet at this joint. We can infer this is the elbow of a young, healthy patient. In this radiographic image of the right elbow, now the humerus is no longer articulating with the ulna. The distal portion of the humerus still portrays a smooth, clear edge versus the ulna that no longer appears smooth, and there may be a loose body shown within the olecranon fossa. There does not appear to be any issues with the radius or the proximal radial head. Upon inspection of the patient, it was clear he was in severe discomfort, reporting his pain being sharp and rating it a 9 out of 10. Visible deformity is noted on the right elbow with some swelling and spasming of supportive musculature developing. However, no bleeding, scarring, or atrophy was present. The student mentions this as his dominant hand. His dermatomes were still normal, and so was his capillary refill. Due to the visible deformity noted of the elbow, measuring range of motion, manual muscle testing, special tests, and myotomes were not performed. After the patient was evaluated, a vacuum splint was placed around the elbow and the athlete was then transported to the local hospital to have his elbow reduced. I found a video on YouTube showing an elbow reduction. This particular person dislocated theirs due to a snowboarding accident. Nevertheless, an elbow is an elbow. Here are some graphics depicting how the bones are misaligned currently. With two clinicians, one stabilizing the humerus while the other is holding the forearm, traction in a posterior direction is applied to provide room for the reduction, while there is a distal force applied to the forearm to move the ulna back into place to articulate with the humerus. Okay, so the elbow is reduced. Now what? The athlete was placed in a sling and advised to keep his elbow immobilized for the next 2 weeks. Thereafter, he could begin to move his elbow again, focusing on regaining his range of motion and slowly incorporate a strength program for surrounding musculature at the elbow. This athlete was fortunate to regain full motion at the elbow, as well as not develop any issues from the dislocation. When patients dislocate their elbows, there are some concerns that we want to keep in mind. Range of motion is important. However, you can perform most activities of daily living without it. When having to reduce an elbow, bony alignment is important to prevent future irritation at the joint or cause further damage of the articulating tissue, since this can lead to degenerative changes sooner, which ultimately becomes arthritis. My case study was fortunate. He did not suffer any serious internal injury regarding fractured bones, severed ligaments, or any neurovascular issues. These would require surgery and a much lengthier recovery process.